name is Maria, and I'm a circulator here at Altoview, and I've been here for a little bit over 4 years now.
Leanne Dewey. I'm a operating room nurse, and I work in the ORs.
It all started a long time ago. My best friend's mother was a surgical nurse, and it sounded really exciting when I was a kid.
We take care of the patient, and we have all the supplies they need, the sterile instruments they need, all the implant that they need. We do all the charting that goes along with all of that.
We do a lot of orthopedic surgery. We do a lot of total joints. We do a lot of laparoscopic surgery, which is with a camera. So we have video towers here. And we use laser lock, both in all kinds of different surgeries, urology, orthopedic, all kinds. And
you do amazing.
we're just amazing.
I've worked at Altoview for 16 years, and I've been in the OR over 25 years.
Okay.
Yeah, I'm going to say.
So what was your career progression? How did you get to the operating room?
Yeah, my first job out of nursing school was at LDS Hospital in the OR, and they trained me to scrub and circulate in the OR, which is nice because not all nurses get to scrub, and I really enjoy doing that because you pass the instruments to the doctor and you get to see more of the anatomy. That's really exciting. They trained me. The OR is a lot of just on-the-job training, and so experience helps a lot. It takes about a year or two to get comfortable in the OR.
My team is excellent.
What are your future goals with Intermountain?
Well, my goal is to, hopefully one day I'm going to be Joyce. Yeah. I would like to maybe do some management or administrative work.
I'd like to retire here. I'm excited that they still have a pension plan, which not a lot of companies offer. So I'd like to just work until I retire and collect a pension.
But first thing in the morning, we wipe everything down, wipe all the floors, and we have the case card, make sure we got all the instruments, all the equipment we need, make the bed, we set up the back table, bringing all other extra equipment we might need. Then I go over and interview my patient, make sure everything is correct in the chart. And we'll bring the patient in here, and of course anesthesiologist talks to the patient too before we bring the patient in. Bring the patient in, anesthesiologist starts an IV, and we help anesthesiologist assist as anesthesiologist. And put the patient to sleep, and then we prep the patient for the surgery.
Well, we have great people. I love the people I work with. They're really professional and well-trained and just pleasant and care about the patients, and so it's a great team effort. I love that.
Every room is set up very similarly. We have our anesthesia cart, and our anesthesiologist will be at the head of the bed. We help them get set up and position the patient and do all those types of things. We have a lot of pumps and tourniquets we use, suction, and Bovies. We use different medical gases for different things, such as cryotherapy. We use lasers, endoscopic and arthroscopic surgery, so we use these towers and these types of things. We have our laser here. We do a lot of things with different light sources. We do a lot of plastic surgeries that take things. This here is this is probably just a few of our urological instruments, but you can see how much instrumentation and equipment is needed. This is one of our new tables that we use for doing backs. This hooks onto our other tables, and we also have a HANA table. We do anterior hips now, and we do all kinds of different things. So we have quite a lot of equipment that it takes to learn and to know how to do things. Use a lot of suture, and you'll have to learn which sutures get used to where. We have our opportunities to go to classes to learn to stitch, and quite a few of our scrubs stitch for the surgeons, even the plastic surgeons, and if you were to scrub, you would do quite a bit of stitching. So, one of the fun things that you get to do here at our facility is that the nurses start all the IVs on the pediatric patients. So you get to keep track of your IV skills, and it's great to do because they're asleep, and so never is a problem. So we have pediatric cards. This is some of our ENT equipment. We have a lot of it. We also have several different kinds of microscopes for eyes or for ears or different things like that, plastic surgery. So we have a lot of fun stuff.